We now want to look at another enabler. I think a lot of us have been talking about it, and in previous sessions we were talking about data. So to speak about data, let me invite first Simeon Namana to say a few words about how we, in his work, we've exploited and explored the use of data to advance nutrition, the nutrition agenda. Simeon is a PhD, has a PhD in international nutrition from Cornell University. He's an expert in food technology. He's from Ouagadougou, Burkina Faso, from Africa. and he has a specific research interest and experience in food, in food insecurity and its nutritional and non-nutritional consequences. He's an author of several peer-reviewed journals and publications. Simeon is currently the regional advisor for nutrition in UNICEF West and Central Africa. Simeon, the floor is yours.
Thank you, Eddie. Good afternoon, good evening, everyone. I'm going to share with you an experience in West and Central Africa on how we use data to advance nutrition programs. I have 2 slides. I would appreciate if I can have them put up, because I'm not sure I can share my screen. All right. Before I get into how we went systematically on the use of data, I would like to give you a bit of overview on the UNICEF West and Central Africa region. It is a region with 24 countries, and together those countries are home to 11% of the world under 5 children. However, they are also the home to 20% of the world's stunted children and 35% of the world under 5 death. It means that there is a big discrepancy between population size and also the burden of child-related issues in this particular region. We all know that breastfeeding is important, and adequate child feeding and breastfeeding in particular is critical for survival, development, and growth of children. And there is a lot of evidence on that. But when we look at the data in this region, only 3 out of 10 children are exclusively breastfed. And the remaining 7 children who are not exclusively breastfed are not exclusively breastfed for different reasons, because they are receiving other food in addition to breast milk. Breastfeeding is a priority in the UNICEF regional plan for the period 2018-2021. And we really wanted to make sure that we focus and work on this aspect, which is the first line of defense and the first line of prevention when we are talking about malnutrition. But because the situation has been not improving for many years, we thought that we needed to really be innovative, thinking out of the box, and trying to be a bit more focused and going to scale to make sure that we make a difference when it comes to improving breastfeeding, because 30% of the babies who are exclusively breastfed, that is 20 percentage points away from the 50% of the World Health Assembly 2025 targets. And doing business as usual will definitely would not get us to meeting that goal. So because of that, we decided to be very systematic in looking at the data and trying to understand how we can reimagine the breastfeeding programming. And we started by looking at the first step, looking at quantitative data. And this is illustrated by the first graph that you see on the upper side of upper left side of the slide, where the yellow bars are showing the proportion of babies aged less than 6 months that are exclusively breastfed in a number of countries in the region. And the blue part of the bars are the proportion of the children who are fed breast milk plus water. The blue bar represent those breastfed receiving water in addition to breast milk. And clearly, if we are able to remove or reduce the proportion of babies who are fed water, we would bring the rate of exclusive breastfeeding to, in most of the countries, except maybe two, to the level of 50%, which is the 2025 target. So this analysis of the quantitative data has helped us to identify a critical bottleneck, which is really water being the problem in most of the countries of the region. Then we went ahead in a second step to try to understand what are the social, cultural barriers to child feeding in general and to breastfeeding in particular. What are the influences of child feeding in the community, in the families, and what are the enabling factors that we can leverage on to improve breastfeeding. And we did that work together with Alive and Thrive, and that has helped us to really understand where are who are the people in the community we need to target if we need to make a difference in breastfeeding. We also identified the factors that can enable us to make a difference at the community level and in families. And that study, qualitative study, led also to programmatic recommendations. Now, building on these two analysis of quantitative and qualitative data, a regional program was designed, which is called Stronger with Breast Milk, and you can see the logo on the right-hand side of the slide. And the objective is really to focus on advocacy to change social norms and behaviors. And it is a large regional campaign. And right now, 19 countries have subscribed to the campaign. The campaign was launched in Cote d'Ivoire late last year, and it is being now rolled out. And the idea through this program is really to support, promote, and protect adequate child feeding practices, breastfeeding practices, and to support the families to engage the community systems in this initiative, to also strengthen this healthcare system and improve the norms and the practice at that level, to engage the business sector as well, and to improve the perception and the social environment around child feeding, and strengthen the national policy and regulation related to breastfeeding, especially some regulations like the code of marketing of breast milk substitute. And the overall outcome we are aiming at is really to push most of the countries engage in this initiative to be able to remove water from the feeding of children and to be able to achieve the 2025 World Health Assembly target for exclusive breastfeeding, which is 50% at minimum of the children being exclusively breastfed. Now, the program was launched and it's being rolled out. Now we are in a stage where we are working on the next steps, which is really to um, work on the monitoring framework and be able to monitor the countries and see how they are progressing and see what are the bottlenecks they are facing in the implementation of the campaign and help them readjust the program. We also need to engage in knowledge generation and knowledge management to document best practices in countries that are making progress so that the other countries could use that and also speed up the process toward achieving the objective and do the adjustment of the program as we go. And this is an example that we are just taking to share with you on how we use data to design a program aiming to reduce malnutrition. We often hear that we are lacking data in many sectors, and this is true. But it is also true that we can do a lot with the data that we already have in hand. And I will stop here, and we'll be happy to take questions.